a story or two about that. Then we'll say it some other day. About
move on. 914 here, Dr. Michael pediatrician. He's also with the Physicians Advisory Group, the education chair. Good morning, Doc.
Hey, morning, guys. Thanks for having me on.
Always. We wanted to bring you on because we have heard just over the last couple of weeks some really concerning pieces of info, and I don't know what you're seeing at the clinic level, but we heard from Margarita Gay, public health nurse, just about a lot of sick kids cycling through to be tested up at the TGen testing site, and they're turning positive. We also hear from Lillian that there's sick kids who are cycling through the ER, testing positive and then being released to home care. And then we've also heard about a couple of pediatric admissions. And so obviously with the conversation in the States with the Delta variant and, almost all of the school kids 12 and under, well, yeah, all of them being unvaccinated, it's kind of creating this like perfect storm of worry for a lot of the grown-ups in our community. So I guess we'll just start there, Doc. Like, what can parents do to keep their kids safe from the virus? And then when they do get it, what are we seeing locally?
First, we'll start with what's happening when they're getting it. You're right. We're definitely seeing an uptick in cases in the hospital. I think all last year when we had the first surge, it took a while before we had our first kids. And then I don't ever remember having like more than a kid at a time in the hospital. And even that was far between. Over the last week, I was on call for just a couple of days. I saw 3 kids and 2 of them were admitted. Thankfully, they look pretty okay, even though, one did require a little bit of oxygen, but it never got kind of worse than low levels of nasal cannula. And the other ones were just kind of watch for observation. What we're generally, it still seems to hold true, but yeah, it's just seeing a couple extra kids in the hospital, and I saw another one in the ER. Yeah, it's making me nervous. And definitely, when I ask around, it seems by far the most common route or the mode of transmission that they're getting is from the household, right? There are definitely cases, I'm sure of it, and I definitely know of one where it went child to child, and they got at school, everybody in the house was vaccinated, did everything they were supposed to. But by and large, what we're seeing is there's one or more people in the household that are not vaccinated. They bring it home and then it spreads. So I have in clinic, I've noticed that, most of my families are really good. They're all vaccinated. Every once in a while, one will say, oh, I'm vaccinated, but, the other person isn't for whatever reason. Sometimes they just can't get it. And then, that's kind of where the weakness in the protection lies, right? And so one thing I would just really want to reiterate to everyone is the way to protect our kids, because you're right, they're just 12 and under, they're just not going to be vaccinated. They're just going to be so vulnerable, is to vaccinate everyone in the household. And I've got to say, though, for the most part, families, that's what they're doing.
Right. So when they're getting it, the kids are getting it, can you kind of just run the gamut of the symptoms that they're experiencing? Because I've heard different things with different kids.
Oh yeah, so some kids will get it and you won't even know. There was a kid I saw in the ER for something completely unrelated to COVID, and they're like, oh, by the way, this kid tested positive, looked great, didn't have any respiratory symptoms, and it was just he's positive because mom was positive or the parent was positive. And it was like, okay, and this is kind of what we saw last year. Like, they would be positive. I would have families where both parents were positive, but they, the toddlers or the babies were just looking completely well, and you would never know that they were sick with anything. And then I've seen they get a little bit sicker. The other thing that makes it a little bit complicated is right now we're heading into kind of RSV season, which is another virus that's always around, and it accounts for kind of a spike in cases October through about February, in Guam as well as stateside, and it'll cause what we call bronchiolitis. So big people will get bronchitis with the big airways. Bronchiolitis are the little airways, and they just get plugged up. And so it'll look a lot like that, but they'll just kind of continue to have symptoms. When I saw a couple COVID x-rays with kids, it was, there was no big consolidation of a massive pneumonia, like, oh, there's like a bacterial infection. It was just kind of patchy throughout. So it looked like a viral pneumonia. And the severity of that, as we know, can vary from something pretty mild that somebody can just handle with a day or two of oxygen and then get discharged, or it can really progress. Thankfully, so far with the kids, it's just been relatively mild. But with the Delta variant being so contagious and aggressive, if we imagine, how many kids we got 0 to 14 or 12, like 40,000 kids, those eventually somebody's going to get really sick, and
right.
I really would hate to see that.
Is that the biggest difference here? Because when you describe what we saw last year, you're right. It was like, I mean, knocking on wood, but big part of me is like, why aren't more kids getting sick? And then the ones that we did see were like, I got COVID, and they're running around like, keep still, boy. But now with this, is it the Delta variant that's?
It's probably a bit of Delta variant. I think we're also better about testing kids. Last year, a lot of our focus on testing was the elderly, right? And kids, because we're like, well, they're not getting so much sick very much. Probably weren't watching them, maybe, and probably a few kids probably slipped through and, did well enough and they recovered and we didn't know. Now that, we're shifting our focus because most of the elderly are vaccinated, we're catching these smaller cases, which explains why, we're getting some kids that we just watch for a night or two in the hospital to make sure they're doing okay. And once they turn the corner, we can send them home.
And let's talk about parents who do get kids who end up testing positive. What can they expect, and at what point? Because just again, we're hearing from the hospital people that parents are bringing their kids in. At what point do they bring the kids in?
Oh, definitely. I would say to any parent, COVID or not, if they have respiratory symptoms, you got to bring them in, right? So if we have a fever, everybody's going to be breathing faster. Everybody's heart goes up. So, make sure, wait till the fever goes down would be, if they look safe enough. And then if they look like they're struggling to breathe, that's never a good sign for a kid. Of course, there are kids with asthma out there. That's not an uncommon thing. So COVID or not, if they have respiratory symptoms, they just might need to get their asthma treated. They might have the RSV bronchiolitis if they're a little bit on the younger side. So that affects mostly 0 to 2. I'm really nervous up to about 18 months for them. But especially if they've gotten sick for a little bit, typically days 3 or 4 are going to be the worst with any viral illness. And typically we expect them to kind of get better, right? And with mild cases of COVID, we're seeing that. But 5 days, 6, 7 days out, and they're still not looking that great, or their breathing gets worse, yeah, that's definitely time to take them in and get seen.
Do you recommend that parents have the pulse oximeter in the house, or is that something that you would do with the kids, or is that more for grown-ups?
It's useful. The caveat to that is, just for a little context, little tiny babies, they have this thing where they have apnea sometimes. It means they just kind of stop breathing for a little bit, but it's not really apnea until it's about 20 seconds, which is a long time to not be breathing.
Yeah.
And there was a study a long time ago. They were like, oh, maybe we should send parents home with a pulse ox. What it did was really freak out a lot of parents, really stress them out because you're testing all the time. There's a thing with the pulse ox, that number you see, might not be valid because it needs to have a good waveform that you can see on the hospital monitor. You can't really see in the take-home test. So it might dip down really quick to like 73. You might go, oh my God. But in reality, it was just either a bad reading because it wasn't placed right or something. So it's a mixed bag. If parents know how to use it correctly, I would say, yeah, it can be a helpful tool, but I could really see it alarming a lot of people unnecessarily. So
right,
as a blanket statement, I probably wouldn't say you should go get one.
You're right, though, because I don't know, as a parent, especially when they're young, you listen, you're doing stuff, you're listening to the baby breathe when they sleep, and there are those little pauses, you're like, and then it catches up again, so okay.
Yeah.
Doc, so kids with like pre-existing medical conditions, are there any types of conditions that maybe parents should really kind of look out for? Maybe, obviously, you mentioned asthma.
Yeah, definitely anything lung related, but it's the same thing with the rest of with COVID for the adults, right? So, diabetes, any immunocompromised situations. Thankfully, not a ton of kids are going to have like liver and kidney issues, but there are some on island. So anybody with any comorbidity really, obesity. We have kids that are obese as well, and so those kids need to be watching out too. Thankfully, for the kids that are 12 and over, we have the Regeneron, I believe, that's available for them, and they still qualify as well. So we're trying to spread the word to other pediatricians saying, hey, you could refer your kids out. Health and Human Services had pledged that they're going to give Guam as many as we need. So, we don't have to be in a situation where there are in other states where they're saying like, oh, if you're vaccinated, you can get it. If you're not, you're not. I don't know if you saw, there's this thing going around, the 7 stages of COVID. I think it came out from a respiratory therapist, like in the LA Times. I think it might be a week old or so. You can look it up, but it'll show you the 7 stages. And he's saying like, oh, stage 1, they have a little bit of trouble breathing. They go to ER. Stage 2, they get a little bit worse. They feel like they're drowning. And it keeps going down the 7 stages. Thankfully, for most of the kids, we're seeing like it's stage 1 or not even quite that bad. But we just, of course, don't want it to see any kids that go on beyond that. Right?
So home treatment, parents, the kids get COVID, sick, maybe not sick enough to bring to the ER or the hospital. What's the best way to treat it?
Same way we would with any other respiratory or viral illness. We got to treat the symptoms, and then just really, it's going to be more about monitoring and making sure that the breathing status doesn't change. Because what I really would not want to do is have parents watch and be like, oh, it got a little bit worse, but maybe we'll wait and see if it gets better. Like COVID is not one that we want to wait and get better. Let's be a little bit more conservative with COVID. Sometimes with other viral illnesses, okay, if they look like they're having a rough spell for a couple of hours, let's see what they look like. And if it keeps getting worse, oh my God, of course take them in. But COVID, like once it gets worse, like there's really no need to wait, especially if you know that they're positive or have a strong reason to believe that they are.
Right. Well, thank you, Dr. Very helpful conversation. Appreciate it.
Okay, cool. Oh, I want to mention, I've been seeing, so of course I see pregnant moms come through too to my clinic, and I've noticed a lot of them haven't been vaccinated. The American College of OB-GYN and the Maternal Fetal Medicine Societies both recommend pregnant and lactating women to get vaccinated. Just, personal anecdote, my wife got her first shot before she knew she was pregnant. She definitely got her second shot after she knew she was pregnant. We have other doctor friends that are in the same position. They all got their shots. And it just, I don't know if you maybe want to get OB-GYN on sometime, because just whenever I'm at the hospital, it seems like I always kind of see 1 or 2 pregnant moms that are like COVID positive, and some of them get really sick. And we've had some really severe cases last year that are honestly like really frightening. And being pregnant, you're immunocompromised. But maybe you can get an OB-GYN on to talk a little bit more about that.
Yeah, we're trying to because we had heard kind of like conflicting information about the vaccine, because I just know a lot of pregnant women who are just not taking it, and it was at the advice of their OB-GYN.
It might have been maybe earlier. Like I think last year there wasn't quite enough for them to say like, oh, it's up to people. But now if you look at those 2 medical societies, which are I think the biggest in the country, they're full on recommending the vaccine.
Right. There was even something that was going around from Dr. Shea in some chats that talked about a correlation between like miscarriages and taking the vaccine, but when we ran that up to public health, they couldn't confirm it, so I didn't know what to do with the information.
Yeah, and I think COVID itself can also cause miscarriages, so, yeah. But, all right.
All right, then. Well, that's a big note to leave on, but yeah, I guess we're going to get an OB-GYN. Thank you, Doc.
There you go, guys.
See ya.
All right, thanks, guys. Have a good day.
All right, 9:28. Yeah, we're going to go to